All right, as far as I can tell, we are live on YouTube, and UGTV will be starting in about a minute and a half.
Thank you. Once again, Rocky, if you would help me monitor hands raised, I'd appreciate it. Just go ahead and interject.
Will do.
Thank you.
Live on UGTV.
Thank you. As I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and is current guidance from the Kansas Attorney General. Now call the meeting to order. Would you, clerk, please announce the meeting and call the roll?
A special session is being held on Thursday, July 30th, 2020 at 5:00 p.m. for a CARES update. First for an update by the COVID-19 and then followed by a CARES review. Roll call. Bynum?
Here.
Burrows?
Here.
Townsend?
Here.
McKiernan?
Here.
Ramirez?
Here.
Johnson?
Here.
Kane? Commissioner Kane? Markley? Walters?
Here.
Philbrook?
Here.
Has Kane joined yet? Alvey?
Here. Thank you. All right, tonight we're first having an update on COVID-19, and then we'll have a presentation regarding the CARES Act review. Turn this over to Mr. Bach to introduce staff.
Thank you, Mayor. Pleasure to be here this evening. We haven't done one of these updates in a while, so we have Julianne Van Loo, our Health Department Director, and Dr. Alan Greiner, our Health Officer, both here to do presentation with probably some other staff members. So I'll turn this over to Ms. Van Loo. Julianne, go ahead.
Good evening, Commissioners, Mr. Mayor. Thank you for having us again this evening. It's just myself and Dr. Greiner tonight, trying to rotate out and actually send staff on some PTO to keep us all afloat. So, but we'll be happy to take questions once we get through our presentation. We'll do as we normally do and start with an update on the data. We've been surpassed by Johnson County in total cases, but unfortunately, of course, given the population difference, our rate remains considerably higher. Our 7-day positive moving average, though, has come down in the last 2 weeks. So you can see here we were up between 90 and 95 for a few days about 2 weeks ago, and we're now around 60, which is very encouraging. We're trying not to get ahead of ourselves, but it is positive. This is not the exact trend being seen around the metro, unfortunately. Jackson County and Johnson County are seeing their trends a little bit differently. They're not seeing it come down like we have in the last couple of weeks, and Jackson County is actually seeing a spike. So, of course, we do not live on an island here in Wyandotte County, so that has an ability to affect us as well. But currently, we're watching the trend come down and feeling good about that. Our rolling averages for deaths is up just slightly. Unfortunately, we actually had 2 deaths within the last day or so. So you're seeing that rolling average trend up just a bit. We haven't had significant outbreaks. I believe some of these deaths that we've had in recent weeks are related to the several outbreaks that we currently have in long-term care facilities. So We've been intervening and working closely with a number of those, but again, our deaths overall remain fairly low. When we look at percent positivity, we're still hovering around that 20% mark, and this is the same thing that can be said for our testing within the health department. So our own testing is coming back positive at about 20%, and that's the same for the county. You can see it's just coming down slightly over the last week or two. We're monitoring that closely. Again, aside from the large health systems, very few places in the county are doing asymptomatic testing. So we believe a large reason why our percent positivity is high is we are screening fairly well and keeping testing for individuals who are either symptomatic or have been exposed to a known positive case. But again, we would like to see this rate come down below 10% before we really know that we're starting to get on top of this thing. So we've got a ways to go on this indicator. Wanted to do another quick update on race and ethnicity in terms of case rates and testing. So you can see on the left-hand side here, our Asian demographic in Wyandotte County still has significantly higher race-specific case rates than any other race. You can see the Black rate is a bit below white, which is a little bit surprising for some. It's different than the trend that we saw at the outset of COVID. And then when you compare that to testing by race in our community, it's a little bit different. So again, the Black community is a little bit lower than we would like to see. We'd like to be there, have their race-specific testing rate at least up on par with the white population, if not closer to the Asian population, to be sure that we're catching those positive tests. The real story is related, unfortunately, to ethnicity. So we're seeing Hispanic case rates 3 or more times the non-Hispanic case rate. And I think anecdotally, we would say from the health department, that's absolutely what we're seeing. Unfortunately, when you look at testing rates, they're actually testing at a higher rate than non-Hispanics as well. So we're glad about that. We've been pushing really hard, ensuring all of our communications that are appropriate are translated to Spanish, getting out there on Spanish radio and other ways to promote testing among that community, just because we know that their case rates are so high right now. So this again remains a large concern for us, and our health equity task force is taking it really seriously and ensuring that our pop-up sites are in locations where we can get to that demographic.
Commissioner Bynum has a question.
Sure.
Oh, thank you. So can you go back 2 slides? That one. The slide on the left is confusing me. The number 7,000, 6,000, 5,000. What is that?
Great question. So we work with rates in public health, which means the number of cases per a certain number of population. But that does not compare apples to apples to just look at, so the number of Hispanic or Black cases, for example, compared to the entire population of Wyandotte does not make a lot of sense. So we look at the number of cases per the Black population and the number of cases within the white population against their full population count. Does that make sense? So it's looking at the rate only within that particular race. So I'm making these numbers up, but if we had 10,000 folks who identified as Black in our community and 2,000 were positive, we'd have a rate of about 1/5, right? So we're doing it per the Black population rather than 2,000 Black individuals out of 165,000 in our community, which would make their rate seem much, much lower than it is. So when I say it's race specific, it's talking about the number of positive cases per that entire demographic population, not the entire population of Wyandotte County. That makes sense?
I'm getting there. The numbers along the left side, what do those numbers represent?
Let me
So-
throw another
Go ahead.
rate out there. If for example, Commissioner Bynum, if we had 100,000 Asians in Wyandotte County, which we do not, but if we did have 100,000 Asians in Wyandotte County, there would be 6,300 cases of COVID. So
That's the part I was not grasping. That's
right.
exactly what I needed. Thank you. Because I was looking at the Asian bar and going, that's higher than the total number of cases
Right.
we have in Wyandotte County total. Okay, thanks.
I'm really glad you asked. Thank you, Dr. Greiner, for bailing me out. something that when you know it, it feels intuitive, but it's difficult to explain. So let's see, we'll pop us back. I've just got one more slide I want to cover before I turn it over. I just wanted to give you all an update on how contact tracing is going in our community. And first let you know that we are not alone in being significantly behind on contact tracing. So virtually every county in the metro is significantly behind. And if you're watching the national news, the same can be said across the country, unfortunately. So in the past 4 to 5 weeks, we've hired on 2 to 3 new contracted contact tracers every week. So we're trying to bring people on as quickly as we can. It does take a fair amount of training, both through KDHE and our own process and workflow. So it's hard to bring on a whole bunch of those new staff at the same time. And then we do have existing health department staff members who have been repurposed and are also contact tracers. So we've got this group of 15 or so folks doing this full-time paid, and then we also still have a group of volunteers of about 10 or 15. So we do have a significant group of people doing this, and yet we are about 800 cases behind, which is very problematic because testing is only as effective as our contact tracing. So if we're getting back to people and asking them to isolate 10 days after a positive test, it's likely that they have been out in the community before them. We do give them guidance when they get tested to remain quarantined or isolated until they hear back about their news or their test result, but that doesn't always happen. So we are feverishly trying to be creative about this and how we get caught up. Last week we did a contact tracing blitz where we got about 15 or so other UG staff members from different departments and some community volunteers to come in and do 2 days, 8 hours of contact tracing, and they knocked out 300 cases, which was a great success. We plan to do that again next week with many of the same individuals to just try to keep knocking out a few hundred cases this way. Our current ability to contact trace is really equal to the new positive cases we're seeing. So we're seeing about 60 new cases a day, and we can contact trace around between 55 and 65 cases a day with our current staffing load. So we're keeping up, but we still have this backfill that we've really got to get under control. So we're moving as quickly as we can. We're allowing fairly significant overtime for staff who's doing this to do this on the weekend to try to come out of this hole as much as we can. It's just a very difficult one. And then one other thing I just wanted to kind of throw on people's radars, as I know you'll be considering the CARES funding later, are one of the reasons why we in Wyandotte County have not outsourced our contact tracing to a third-party firm or the Kansas Department of Health and Environment is that our contact tracers ask a number of screening questions and provide significant resources to the folks that they're contact tracing. And it's of note, I think, that 40% of all the cases that we've traced in the last several months report having difficulty accessing food or cleaning supplies. So either they don't have someone who can get it for them so that they can remain quarantined or isolated, or they've lost a job or are currently unemployed and cannot afford it. So I think this speaks, this again is just the positive cases in our community, those who are infected with COVID, but speaks to just some of the need that is experienced by that population. We've got a few more updates here. I'll send it over to Dr. Greiner to talk about health orders.
Yeah, and some of this is a repeat of what you all have seen before, but I just wanted to mention again that the mask ordinance and mask order, and of course we had our order in slightly before the state of Kansas order that came along on the 3rd of July. We adopted that order with a few clarifications into our order so that we were requiring masks in places such as daycares and gym settings. And then there was a little bit of language about offices as well. We've got the same sort of enforcement that's education first, just as we had back with the stay-at-home order. And I do think it is possible that our new case rolling 7-day average decrease could be related to this. You know, we're beginning to see that in the last week or so, and we've had this order in place about 3.5 weeks. So that is encouraging to us. I think we're going to get a lot more information, I think, on the national level and from public health and epidemiology experts on this in the coming weeks as well. But I think we are probably going to continue pushing really hard for mask compliance, because we think it's a major way we can control all of this. But for now, we will be remaining in what we're calling phase 3. And so gatherings will be limited to 45 people or less, where social distancing cannot be guaranteed or maintained. Next slide. And then we've been working really closely with all the school districts and the private schools as well in the county. Had a great meeting last week and then finalized our order regarding school reopening and in-person activities at educational facilities this Monday. So we've put in place in that order that no in-person educational activities will occur until the day after Labor Day, so September 8th. That mask use will be mandated by students and staff at the kindergarten level and above. That we will ask school districts and schools to cohort students and staff, so keep the same groups of students and teachers together as much as possible, at as many of the grade levels as possible as well. That we want each district to develop a plan so that they're essentially achieving 50% of the student density in their buildings or facilities. That might mean in one building, but it also could mean they're doing that across multiple buildings and using space that wouldn't typically be used for educational activities, but they're using it to keep students social distance from each other. And then we'll be working with the districts to have plans submitted to us that Dr. Corvo and I will review and work with them individually to fine tune those so that they're all ready to go, hopefully far before September 8th. In fact, I think a couple of them said today on our 11 a.m. call that they've got their plans ready to go. So we'll be working on that in the coming days as well. That's it for me.
For both of us, we're happy to take additional questions.
Mayor, it's
Commissioner Johnson?
Bynum, go ahead.
Yes, Commissioner Johnson, thank you.
Thank you, Mayor. And I don't know, Dr. Griner or Julianne, either one of you might be able to answer this. And I always have asked questions about our level of communication, either regionally and or also, I guess today mine is really relative to how we coordinate with the state. And how frequently are we in contact with Dr. Norman in terms of making an assessment of where we are as a community, and then how does that align with how he is, along with the governor, making those same kind of decisions for the state? Are we? It just seems like there's a bit of gets kind of wonky sometimes, as in terms of when we come out with the policy, they come out with the policy, we revert back to their position in terms of alignment. And I'm just trying to figure out, is there a way that we have or already attempted to do this and that's just the way it's going to have to be? Or is there some easier way of doing this so that, and I realize they have all the counties around the state to contend with as well. So I just wanted you to speak to that one way or the other, either one of you.
Yeah, and I'll just speak to the issue with Dr. Norman. I feel like we've been in close touch with him throughout the pandemic. I don't know that I talk to him every day, but we're text messaging back and forth on a regular basis, trying to keep things coordinated. I do think that, as you say, we could probably do a better job in making sure that we're not having to switch ordinances and orders and backtrack and so forth. And so we'll be working to do that as best we can. I do think they're facing challenges at the state level that we may not face. So there may be times we're going to have to continue to do independent things to protect our citizens. But I think we've probably done more I'd say in the last month, really working on the metro and trying to coordinate with the core four, and that continues to go well. We've got some support from Mark, Mid-America Regional Council on that, and I think that'll be an area where we've got to keep working as well.
Thank you.
Commissioner Bynum?
Thank you. I just wanted to step back and dwell for a minute on that bullet point of remaining in phase 3, because the concerns that have been coming to me are questions about whether we're going to step back. And so I'm happy to see that that answer appears to be no right now. Is that right?
That's right. I think that the two primary data points that are keeping us feeling like we don't need to step back, we don't need to look necessarily to closing bars and restaurants right now, are that the death rate continues to be really low for us, both in Wyandotte County and the Metro, and that, at least in our county anyway, that 7-day rolling average of new cases has begun to drop. We're like Julianne said, we're not necessarily seeing that all across the Kansas City Metro, but we're also seeing that in some other states around the country. And again, we're very hopeful that the mask use is what's driving that, and that we can focus on that in the coming days, rather than having to think about, all right, well, how do we step back, or what sorts of new things do we put in place to restrict people? We just want to get people wearing masks all the darn time, and we think that can be really what has impact for us.
I'll also note too, to both Commissioner Johnson and Bynum's question, the administrators and health directors were on a call this morning across the Metro, and it sounds like the other jurisdictions plan on holding tight where they are as well. Jackson County is considering reducing their gathering size, but likely not looking at other more restrictive measures within the next week or so. So that group will reconvene in 10 days or so and look at the data again.
Dr. Greiner, if I might, did not Governor Kelly suggest that for the state of Kansas, there may be a need to step back to a more restrictive zone?
If she did, I missed it. Maybe Julianne saw something and can comment.
She did earlier this week, but we know she does not have authority to do that until at least early September, given recent legislation passed. So, you know, it's where she would prefer, I think, some communities to be, but I don't think there's any ability for her to make that call.
Commissioner McKiernan?
Thank you. I'm just curious, are we getting hospitalization data any more regularly than we were at least a couple of months ago?
So we have found a couple new pathways to get data. We've got the chief medical officer at the University of Kansas Health System, Dr. Stites, giving us weekly data from a meeting where all the chief medical officers in the Metro get together. So that's been helpful. We're also having regular meetings now with the executive team over there, and there tends to be more communication among the executive teams at those hospitals, I think, than maybe we originally realized. So that's been a good source of data for us for the past few weeks. You may have seen the federal order that changed the reporting of hospital data from CDC to HHS. That's very worrisome to us, because right before that order came out, we got wind that we were going to start having the availability of this data we had wanted for months. But we think this workaround strategy we have is going to be helpful to us. And there seems to be more coordination. Our understanding was the biggest problem was the HCA hospitals in the region not wanting to contribute their data, but it seems like maybe that is changing, and they're cooperating and contributing a little more now.
I'd also like to publicly thank Representative Kathy Wolf-Moore, who is sending us daily the hospitalization and ICU and vent counts, but she's also has began giving us an update on how many Wyandotte County specific residents have been admitted the day before or the 2 days before. So previously it's been hard to know with KU because they serve so many jurisdictions what of that is Wyandotte, and so we're just starting to get that information as well, which is really helpful.
So I would assume that our hospitalization rate is still good, or that there is still headroom or capacity available, and that we are not reaching any sort of a saturation or a getting full standpoint?
In our county, things really look fine. KU's numbers are higher right now of COVID patients than they were at their absolute peak in March. And at Providence, they're relatively low as well. KU has been very full overall, not with COVID patients, but just with overall patients in general. But we've had meetings with them in the last 10 days where they've assured us that they have significant expansion capacity if they needed to find a mechanism to do that, they feel confident that they could do it. So I don't think we're worried at all about the hospitals in our county. And I think the same is probably true metro-wide. It seems like, again, we kind of were expecting the numbers of hospitalizations, even though they're up right now compared to where they were. I think we thought they'd be even higher as of today, maybe even, you know, 30%, 40% higher than what they are for the COVID patients. And it hasn't happened. So probably that's because younger people in general are getting COVID at this point, and even the hospitalized patients are slightly younger as a average. But I think it's good overall in terms of capacity.
And just to
Very
give
good.
you some level of context, they're sitting really around 30 to 35 positive COVID patients in their facility for about the last 10 days or so. So it has leveled off, even though it's increased, as Dr. Greiner mentioned.
Thank you.
Okay, thank you very much. We will now move on to the presentation regarding the CARES Act. Thank you again for your presentation. Mr. Bach?
Thank you, Mayor. As the Commission's well aware, a few weeks ago, the Mayor assigned to the administration, basically to the standing committee, to break it out and have a form a subcommittee of their group to go through and start evaluating a methodology we could for putting together or evaluating how we would spend the $37 million that was awarded to Wyandotte County from the CARES Act. Our committee is here tonight to offer that presentation. I'm going to turn this over to Commissioner Bynum, who is filling in for the chair of that committee, Commissioner Markley, and I believe Commissioner Bynum is going to introduce what the committee is proposing to do tonight. Commissioner?
Thank you. So tonight I'm here as the interim chair of our CARES Act subcommittee, which was designated, as Mr. Bach said, by Mayor Alvey and County Administrator Bach, to bring you the resolution that you're going to see in our full commission agenda. Before we start that, I just want to personally thank and commend our staff and the specified voting members of the subcommittee, which also includes Commissioner Jane Philbrook and Commissioner Angela Markley as the other two elected officials, along with a whole host of staff and reps from Bonner and Edwardsville for the dozens of hours that we've already put into this effort. And I want to particularly thank and appreciate our partners in the cities of Bonner and Edwardsville, because they've come together with us every step of the way so that our community's interests are heard from every corner, east to west and north to south. So what we're bringing tonight is a walkthrough of our efforts to date. And I'm happy to say that as we make our way through the slides, hopefully you'll come to understand how we did our work and the extremely short time constraints under which we are toiling, our nonstop focus on COVID-19 response, mitigation, and hoped for eventual recovery. At the end, the chart that demonstrates we've reached consensus as a working group, we're going to show you that. As to the formula that we're using for allocations to public health, cities, and the county. And additionally, we're going to bring you our commitment that in August, for your final approval, we'll be bringing a breakdown of allocations in our nonprofit and educational sectors. So with that, I'm going to hand it to our project coordinator, the extraordinary Crystal Sprague, and let her walk us through the slides. And just on a final note, since our time is limited in this session, if we could maybe hold questions and comments, jot your questions and comments, and when she's done, the mayor can facilitate our conversation. So with that, thank you very much to all. And Crystal, I'll hand this to you.
Thank you so much, Commissioner Bynum, and thank you, commissioners, for having us today. This has been a process that all parties involved have undertaken with a certain degree of somberness, understanding that but for the hardships in our community, we would not be undertaking this task. But equally, we're also approaching this with a sense of optimism as this dollar amount coming to our community presents an incredible opportunity for Wyandotte County to recover and head down the path that will lead us there. So I'm going to start by giving you an overview of the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act. Commissioners, I believe you've seen this slide before, but just as a placeholder here to let you know that the CARES Act was federal legislation which brought $1.25 billion to the state of Kansas. The task of allotting that amount of money out to the state of Kansas was given by the governor to the Spark Task Force. They were tasked with figuring out how to equitably provide these dollars in the most impactful way, and they divided this funding into 3 phases. The CARES Act dollars were bound by several guidelines, including rules from the U.S. Treasury, and then, of course, the CARES Committee or Spark Task Force clarified some of those guidance issues for us and provided some reporting requirements that we must follow. The first round of funding is specific to Kansas communities. In reference to Wyandotte County, the Spark Task Force adopted a formula for distribution based on population. Wyandotte County was allotted $194 per citizen, as was each other county in the state of Kansas. Due to our direct impact of COVID positive tests and COVID cases, including our impact of job losses and unemployment, Wyandotte County received an additional $34.40 per resident, resulting in a direct allocation to Wyandotte County of just over $37 million. These funds, again, were subject to CARES Act legislation, Treasury guidance, and direct oversight from the Governor's Office of Recovery. To say that this timeline is compressed is the understatement of 2020. This timeline for CARES Act dollar allocation has presented and continues to present some amazing challenges, not only for us, but any of the subrecipients who are awarded money from this allotment. This, like every other COVID-19 pandemic issue, has been filled with fluid pivoting, to say the least. Sometimes we have weekly and even daily changes in the Treasury guidance and the guidance from the Governor's recovery team. The announcement of the county allocations was on June the 16th. Work by Wyandotte County started immediately, and we got to work on what we would do to allocate these dollars. I want to echo what Commissioner Bynum said. The timeline between June the 16th and today's date has been 44 calendar days. So your working group has worked tirelessly to make sure that we get this money allocated in the right way and in the most impactful way. The timeline does not improve as we have our first round of reconciliation and reimbursement reports due to the state of Kansas no later than August the 15th. As Commissioner Bynum mentioned, the CARES Act working group was made up of a cross-section of commissioners and staff, as well as a city manager, Mike Webb from the city of Edwardsville, and Matt Zayas, the assistant to the city manager of the city of Bonner Springs. Immediately, Wyandotte County issued this planning committee, drew us together, and even before the recovery office began assistance and direction to us, this group was meeting and establishing goals for what they plan to get accomplished in this very short time frame. The first goal was to establish funding priorities for our county. The second was to create an application process, and the third to develop allocation recommendations back to this group. The application for funding was immediately released on June the 26th, followed by a series of press releases, several webinars for possible applicants, and community outreach and group notice that application was posted. The state of Kansas provided us on the 26th a roadmap for recovery. That roadmap for recovery issued a series of funding priorities that counties might want to follow. Since your working group was already hard at work, they were able to establish 5 priority areas in which they would like to see funding. And it's nice that those funding priorities echoed what the state laid out in the roadmap. We utilized the roadmap throughout the working group work, as well as establish these priorities listed at the bottom. They are listed in priority order, with the first being to reimburse Unified Government, Bonner Springs, Edwardsville for all allowable expenses. The second, to strengthen our ability to respond in a robust way to public health emergencies, particularly COVID-19. The third, to improve the adaptability of taxing entities. The fourth, to grow requisite human and health services. And the fifth, to build community resiliency. So I spoke a few seconds ago about the pivoting on the recommendations even after the application was released. As clarification was provided by the state, the restrictions in terms of the CARES Act dollars became more clear, and the allocation was to be awarded in two categories, awarded and reported in two categories, the first being reimbursement and the second direct aid. Clarity for this came after the application was already released. So commissioners, if you've heard potential applicants mention words like, I applied for a program or I applied for a combo application, please understand that all applications were accepted with the knowledge that definitions and restrictions were evolving in real time. We have broken all the applications into two funding sources, which would be reimbursement and direct aid. Reimbursement was defined as eligible by the CARES Act and Kansas Recovery Office. It was related to expenses specific to the response and recovery of the COVID-19 pandemic. The reimbursement period was focused between March 1 to July 31st, and counties must provide itemized documentation not only for reimbursements requested at the county level, but also for any subrecipient. The reimbursement is really focused on governmental agencies, and of course, eligibility determinations for the final approval will be made by the Kansas Recovery Office. When we talk about direct aid, we're talking about dollars that are requested to respond and recover to the COVID-19 pandemic between the period of August 1 and December 30. All funds awarded in this category must be incurred by the county or subrecipient before December 30th. That's a pretty steep timeline for some of our community partners. It may include grants to cover reimbursements to some of those community partners, and it's not permitted to be used for capital infrastructure or already budgeted items. Again, eligibility determinations are finalized at the State of Kansas Office of Recovery, and we do expect those to be audited by the Treasury at some point. In both types of funding, reimbursement and direct aid, the county holds the fiduciary responsibility for ensuring that funds are spent within the guidelines. So we've put out the applications, and the application deadline was the 19th of this month. We did receive a great response. We received applications through the working group, and that working group has been assigned the daunting task of reviewing thoroughly those applications and scoring them. We received applications whose contents ranged from very pragmatic innovations and then very stout innovations that would be able to be carried on past December 30th if other funding was available. The range went from problem solving, what some would consider individualized type problems, such as human connection for our seniors by purchasing tablets to allow them to have remote medical visits, all the way to innovative healthcare models that would benefit our community for years to come. But I also want to draw attention to applications that showed a substantial impact that this COVID pandemic has had on our local services, our government agencies, and our first responders. So again, we've had a range of applications, and I've listed some here for you, but those also include those food insecurity areas, utility assistance, similar to what Julianne was talking about, economic disruption and relief for businesses and for nonprofits, addressing those safety needs for first responders. And we saw that across the board, a tremendous response from our first responders in asking for items that would prevent any possible infection and protect their first responders going out on scene. Of course, modifications and adaptions to remote working technologies, certainly medical response items, testing, contact tracing, PPE. We did see payroll reimbursement requests and assistance for positions that had been redirected substantially to COVID-related activities, and even childcare relief for essential workers. So we spoke about those 5 areas that the commission had, or that the working group had set aside as the priority areas for funding. Within those priority areas, applications were received in 5 categories: local government through business. We have listed here the number of applications and the total dollar amount of the ask. At quick glance, you'll very astutely know that our immediate ask was higher than the allotment from the state of Kansas. I think this demonstrates not only the impact of the pandemic, but also the uncertainty that we are facing moving into the fall. Clearly, the working group will have some difficult work ahead, sifting through these applications and making some determinations. As the working group has embarked on that task already, doing that thorough review of those applications, there are some things we already have noticed and will know. As much as the group would love to meet all the needs that are presented, there are applications, even though their merit is high and their impact could be significant, that just simply will not meet the requirement of the CARES Act legislation. Some cannot be completed by the deadline, and others just, even though their merit is fantastic and high, just will not be able to be funded as whole. We've also noticed some overlap in services. Some applicants have already received some CARES Act dollars or allocations. And I will say that some applications have already been withdrawn or altered. We just had one altered today based on a longer ability and time to review those applications. I want to acknowledge that the government agencies had a very short and limited time span to really coordinate priority areas. And I think the funding allocation that the working group is bringing to you today will provide some extension to that, so that our local government agencies will have an opportunity to really prioritize their need. So with that, Commissioner Bynum, if you'd like to introduce the funding formula that we are asking approval for tonight.
So this will be within the, or I guess I should say, this is the allocation formulas to date, if you will, that we're asking be adopted in the resolution that's on the full commission agenda tonight. So we utilized population and established the priority areas, again, which are the priorities that Crystal has just walked us through, with the 2 highest priorities being the reimbursements to the local governments and the protecting the public health. So those are the priority areas for allocation of this $226 per resident. And so you'll see in the slide that's coming that it breaks down as $33.6 to our Wyandotte County Unified Government Public Health Department, 1.2% in administration of these actual CARES Act funds, 44.2% to the cities of Kansas City, Bonner Springs, and Edwardsville, 4% to Wyandotte County as a whole for the county specific expenses, and then 16.9%, which again, we will bring you as a series of allocations among those 501c3 applicants and the educational applicants. And then funding for businesses, we're going to direct to the cities, to each of those cities for review and approval. So that's why you don't see a specific percentage among the small business category. So with that, we'll move into this next slide, Crystal.
Thank you, Commissioner. So here's the math related to that. As you can see, we've got in this top line here that per resident times population at 226. And each one of the priority areas listed with health, CARES team, that's the administrative function, cities, counties, educational, and 501c3s. And when we break those dollar amounts out into those specific areas, you'll see that $76 of the 226 should go or will go with adoption to the health department to allow the health department to continue responding to this health crisis. $100 to the cities, or 44% of the total allocation. And then Commissioner Bynum mentioned the 16.9%, which is a combination of the education and the 501c3 dollars, or roughly $16.20 out of the 226 per resident to educational, and $22 out of the 226 to 501c3s. Again, I'll reiterate, you'll see this business column is blank because we thought it best to utilize the existing structures in the cities to be able to handle those applications. And in doing so, could support long-term assistance, technical and financial, to those businesses who have applied, rather than to provide them a one-time grant and not any wraparound services after. You'll see the jurisdictional breakdowns at the bottom with the individual populations as recorded by the cities and the county and the amount associated there. So what are our next steps? Our next steps as a planning committee are to review and score those final applications, and we will finish that actually between July 31st and August the 7th. The cities and the counties now have an ability to take the applications that have been presented, review the allocation that is hopefully adopted today, and prioritize based on the allocation that's been adopted. And that will give them an additional period of time to be able to find out what they would like to prioritize within that funding sector that meets the needs of their population in the best possible way. And then we will be bringing, as Commissioner Bynum mentioned, for final approval, that last package back to you on August the 10th. So I want to take a minute to say thank you very much for giving us some time. I really want to thank the working group who have spent as many hours as there have been days since the announcement. They've spent well over 44, 45 hours working on this endeavor. Specifically, I want to thank Chair Markley and Chair Bynum or Assistant Chair Bynum for stepping in and leading us over the finish line last night. And of course, Commissioner Philbrook for keeping us on task. Special thanks to Mr. Webb and Mr. Zayas for coming to the table and really bringing different perspectives into that discussion. And a thank you to my newly formed CARES Act team who have pivoted away from their regular job duties to focus on, again, what we believe is a somber thing to have to do, but also an exciting, tremendous opportunity for our county to really see some impact in our recovery process from the pandemic. So at this time, I'm sure that the committee members present and myself will be ready to answer any questions that you might have.
Thank you. Any comments or questions? Commissioner Townsend, I believe, was up first.
Thank you, Mayor. Want to express my appreciation to the committee involved. This was a yeoman task to undertake with no blueprint for anything like it before. So just having said that, let me just ask a couple of questions. And well, we could have started with the last slide that was up there, but that's okay. Let me go to the section, I guess that's, or the recommendation for allocation that have to do with education and 501c3 organizations. By my quick math, we're looking at what, about 6.2 million that's eligible for dividing among groups that were falling out those categories.
Commissioner, I can certainly put that slide back up. I wanted to hesitate from flipping back and forth, but I think this is the material that you're looking for, but you are absolutely correct. Your math is spot on. It's a combination of these two items here under educational and 501c3. So we're close to 6 million, yes.
Okay, so for instance, I'm aware that I think there may be some churches who have put in applications for different things that may seem to, but will seem to appear to fit the criteria that you showed earlier. Is that where they would be considered as opposed to a business for which we're saying 0 up here?
Yes, that is correct, Commissioner Townsend.
Okay. And on August the 10th, The full commission will be asked to do what again? Look at each of these particular or specific allocations that have been proposed, similar to, I'll liken it to the casino grant awards that we're going to undertake tonight. Will August the 10th be the first time that the full board would see these proposed allocations by specific designees?
Commissioner, what we're asking for tonight is an approval of the funding formula.
This
And
process, right?
This process, and then we would be bringing back to you the specific allocations in the educational and the 501c3 as the final product on the 10th. Yes, ma'am.
That would be the first time, though. I guess that's my point. Will we have time before August the 10th to see whatever you're proposing specifically?
Yes, ma'am. We have a pretty straightforward time frame to get you that material so that you've got time to look through it prior to the 10th. And we're hoping to get you that material the morning of the 7th at very latest.
Okay.
Crystal,
right.
Commissioner,
ma'am.
Bynum, just to reiterate, yes, Commissioner Townsend, we want to give you the chance to see the potential allocations among education and nonprofit. And tonight, what we're saying is that our committee has reached consensus on the categories and the allocation breakouts for health, the CARES team administration, the cities, and the county. So we're hoping that those are decided, and then the balance of our work is in the last two categories, if that helps at all. And then, yes, certainly to share that with the full commission so that you can see it before we're all having to decide.
Okay, and I think that's the understanding. I want to make sure that tonight we're talking about this schematic you're proposing now, but I wanted to know what opportunity the board would have to look at the specific recommendations you're making before the 10th. So I understand that's going to be on the 7th, right?
Yeah, at the very latest. We will have a working group meeting in the day before, I think actually on Wednesday before, and we're hoping to get to final recommendation on that day. So as soon as staff can get that material packaged, we'll get it out.
Okay. Again, I understand that you all are starting from scratch on a mission that there's been no blueprint for before because of COVID. So the only thing that I can liken it to, as I said, is the process that we use for the allocation of the casino grant fund to some degree, trying to liken it to that process. Thank you again for your work.
Commissioner Walters?
Thank you. Well, I understood the first part of the presentation, and it had like 5 priorities or 5 criteria that I think you said was contained in the legislation. Could you go back to that slide for me?
Sure.
The 5 levels.
Commissioner Walters, is that what you're looking for?
I think, or maybe go forward a couple slides, I think is maybe what I was looking for. There you go. So it looked like almost all of the $37 million would be taken up with the priority number 1 and priority number 2. But then you went into some sort of what you call math and started dividing the money up based on population, and that's where I lost your train of thought. So looking at this, I would think that local government and public health would consume almost all the money unless we elevated some of these lower priorities ahead of the requests of the higher priorities. Am I missing something there?
Well, I think that it's very astute to realize that those first two categories certainly would make up the 37 million. But I think it was important, and Commissioner Bynum and Commissioner Philbrook will correct me if I'm wrong, that we wanted to make sure that we are impacting the health and human services field as well, or those 501c3s. When we started to get the applications in for local government, it was pretty clear that that would be a daunting task, and maybe the local cities and governments needed a little bit more time to align their applications to, and again, at the same time, we're having new funding guidelines. There were lots of questions about what incurred meant. And so we had applications that came in that might involve requests for funding beyond December 30th, because at that time, the only guidance that we had was a little vague on what those asks would be. So I think the commission and the working group got to a place where they said, okay, well, we know that the ask is great. We have an ask that is double the size of the allocation that we have to give. So how would be another equitable way to make sure that our funding priorities get funded in the fairest way possible? And I think that's where and again, Commissioner Bynum, correct me if I'm wrong, we changed the conversation or the lens on the conversation to say, now we have $37 million and we're working backwards. What do we feel is the most appropriate impact value in each one of those areas? And then let's look at the applications that would fill up that area based on merit and their fit into the funding criteria that we know now after 4 weeks of clarity from the Treasury Office.
This is Commissioner Bynum. I would just, if you would move forward a couple of slides to the math chart. So Commissioner Walters, yes, I would say that if as a subcommittee we said reimbursement to cities and counties and health were the top priorities, which I would maintain they still are, you can see that they do take up certainly the bulk of the funding. And out of the 37 million, they take up 30 million, almost 31 million of the total. And just to add to that, in this community since March, we've been watching our churches, our nonprofits, our social service agencies, our safety net clinics absolutely stop on a dime and immediately transition the way they do business to response. And watching that has been an absolutely incredible thing to view. In addition to that, with the allocation of this money, we allowed for them to make application for some of these CARES Act dollars. So while it would be easy and defensible to say, well, public health and cities and counties need all of the funding, I certainly would not be able to morally or ethically say to the 501c3s and educational institutions, well, we know you're doing an incredible job with almost nothing, but we need all this money for ourselves, even though we said you could apply for some. So I'm just sharing with you my personal belief on part of the way this mathematic chart has come to be. And I'll certainly pause and let Commissioner Philbrook weigh in if she so chooses. Or frankly, I think we have some other subcommittee members online if anyone else would so choose to speak on it.
This is Commissioner Philbrook. I'll just say something really quickly, Jim. Sorry. So, and 501c3 areas is that they're already doing their yeoman's work right now, and several chunks of change. The 501c3s overall, most of them have not. And they're doing it on a shoestring budget in some cases, and then getting backing from independent. And we as the government can't take care of keeping people in their homes by ourselves. We're not set up to do that. But these companies, the 501c3s that have been doing this work for our community for quite a while, they are capable of stepping up to the plate and doing a lot of this work for our community. So that's why they're in there. And I don't even want to think about what it would be if they weren't. And so I definitely have to see them still in there. And that's where I am on this. And this has been a hard fought situation with all of us on this committee to try to find something that is respectful of all entities in here. And Crystal, how many applications were there for the 501c3s?
69, Commissioner Philbrook.
Just 69, which I have not read all of yet, so we know what I'm going to be doing. But of the ones I have read, they are very, most of them are very heartfelt and well taken. Some of them just won't pass the muster to be into this. But on the other hand, a lot of them will. And so I just hope you guys pray for us as we continue to go through these applications and look. So thanks.
Okay, well, getting back to my question, did I understand that those 5 levels were part of the legislation, or was that the recommendations of the committee?
So the first slide that I pulled up had a basic roadmap that was not part of the legislation, but a roadmap to help counties provided by the State Recovery Office. The legislation says that these dollars must be used for a direct response and recovery to the COVID pandemic, and then gives us a certain set of not allowable expenses, for example, capital infrastructure or
Right.
items that were previously budgeted for.
Well, just looking at the chart, there's no way for us who are not a part of your committee to have any idea whether this all makes sense. I understand the role of 501c3s in our community, but I don't know how I could get questions answered based on this information presented. But that's it for me. Thanks.
Commissioner Burrows?
Thank you, Mayor. I too want to thank the committee for the well thought out plan. I really like the $100 based on population of both city and county. I think that's really a fair place to start. So I commend the committee on coming up with that. That way we have a base in which we can start from a negotiation phase, I guess, so to speak, to determine what other dollars will need to be spent. So thank you for thinking of that, because everyone is represented fairly in that by population, by the $100 per person, even the county portion. So I commend you for that. I too kind of share Commissioner Walters' concerns about the 501(c)(3)s or C3s, due to the fact that some of them have already been allocated money, as it was stated earlier, and the same way with the business community. I think it's appropriate that you're sending the money back to let the cities determine what businesses. I guess my question would be right along the same line as Commissioner Walters' question: to what extent will we as commissioners have in determining which businesses and/or which 501c3 companies or organizations receive those dollars? Will we have an opportunity to, is it going to be all voted up and down in one vote, or will they come forward? We'll have a chance to discuss them. I think that's about the only questions I have. And again, I appreciate the work of the committee. I know this wasn't easy.
Thank you, Commissioner Burrows. I will add 2 items there about the 501c3s. The first being, I know that the director of the health department, I can hear her voice right now saying, hey, don't forget those 501c3s that provide pop-up testing, particularly in our Hispanic community, and they are inside those 501c3 applications. So we did get a fair number of medical support or testing partners that would be within those 501c3s. And you are absolutely right. Some of those 501c3s have received CARES Act dollars already, and that is taken into account in the scoring criteria that's been set forward by the sub-working group to make sure that there's an understanding. Additionally, the state of Kansas recovery team has been asked this very question several times. How can we make sure that we have a good, accurate reflection of who has received? Is this a self-report, or do we have some methodology for checking? And the recovery team has committed to the counties that they will be willing to put together some type of public release that we could consume in an easy way to say, okay, well, we've got an organization we'd like to make a sub-recipient. Let's check that against what's been received. So that should be coming. I would also mention that this compressed timeline does make it very difficult even for a group of 9 to review 69 applications just in that 501c3 pile. So what we're hoping to bring back to you later in the month of August, if this funding modality is adopted, is a group of recommendations and some scoring criteria so that you can see those scoring criterias and how each individual 501c3 came out when we're looking at things like, can they meet the timeline? Is the intent of the application, does it fit within the legal guidelines? I will also tell you that if it does not, the recovery team at the governor's office will send that application back to us, and no funding will be released to any subrecipient until it has been approved as eligible at the state level. So I get the understanding there, and I respect the question, because I certainly in your shoes would want to know what each one of those applications said. And we'll do our best to get you the gist of those applications before the 10th, so you have time to look at them. I hope that helped.
No, I think Mr. Bach wants to weigh in to answer this question. I think he wants to describe how the vote will happen, which I think Commissioner Burrows was the final question you had, correct?
That's correct, Mayor. I just want to ensure that if these are presented to us, I mean, I trust my commissioners and the work they do in these committees. We're all able to make these decisions. It's just a matter that we're all held responsible to. So I'd just like to know how the process is going to work.
Mr. Bach? Did we lose you?
Nope, hadn't been talking this meeting, so I didn't have my mute off, Mayor. Sorry about that. So the committee will be coming with their recommendations. How we'll treat this is kind of like an agenda package coming out for you. As Crystal said, we've laid out the directive that they need to, I want to say directive, with the objective they try to get it out at least by Friday. If we can put it out before, recognize that only gives you a couple of days to go through it, but that is a couple of days to get into it in these specific categories in the educational area and the 501c3s and see those breakouts from that perspective. You'll be able to move those dollars around if you want to. When you get to the meeting Monday night and you see a particular area that maybe you don't think should have the same amount of money, or some other area should have more, and I think the committee will be able to answer questions and go to it, but then ultimately you'll be able to make votes and advance it, and we can advance it as a package, try to look at it, see how it comes up, of whether it's broke out by educational 501c3, but you may determine you want to move money from one group over. I think this sets out they're going to be 16.2 in education and 22 in 501c3. So there'll be two separate packages that you'll vote on. But how those are allocated with each one, that'll be the commission's final decision as to how much money they're given. I also wanted to note that the work of this committee, and as I talked to our friends in Johnson County and Jackson County, we're all aware they were direct allocation communities. They've been working on their formulas for a month and a half before we saw anything. And they're about at the same point we are now. So it wouldn't like they've got theirs out there in the public eye to start dividing out a few weeks ago and breaking it out different. So I really commend this committee for the advancement of what they've done in 44 days, basically half the time or less than what the other jurisdictions had. They have more money, but they also have bigger committees working on and more staff members throwing at all their stuff too as well. So a lot of work to get through. Was when they showed me this information as it was coming forward for the agendas, I was quite amazed at the work they put together to get this broken down this way. And I think make it so everyone can grasp it and understand it, and we can continue to advance this on the time frame that the state has set out for us, which is very short. And then after we get the awards, we have to move through and do a lot of work to make sure the money is spent according to all the allocations as they're set out as well, which is also going to be a huge task.
Yeah. So Mr. Bach, thank you for that clarification. I guess one of the questions I also had, Mayor, was it doesn't matter who receives this money, that once we've allocated to them, if they misappropriate those dollars, we are held accountable as the commission for those dollars if they're misspent. Is that my understanding?
This is Commissioner Philbrook, Commissioner Burrows, and what I'll tell you is that we will have MOUs with everybody that gets money. They'll have to sign off on them and say they will be responsible for reporting in a timely manner to what we're requesting from them, because we have to make reports to the state constantly about how that money's being spent. And if we have problems with them, hey, there's always hope not.
Yeah.
Is that what you're asking, Tom?
Yes, I truly believe it's important that if we're going to make these decisions and we're going to be held accountable, that we want every safety mechanism in place that we can, including, those businesses that might have a member of the commission serves on their board. I mean, those kind of things need to be disclosed. It should be disclosed. I mean, that's a pretty transparent process. We all have our entities within the community that we serve. And I'm not suggesting anything would happen, but I'm just stating, I think in full transparency, those types of things can come back to bite us a little bit, all of us. And I think the more we communicate, the more transparent we are. As I stated, I commend the work. This formula is very simplistic. I believe it's pretty fair. I like the $100 setup on population. I think that is very well thought out, and the county portion. I don't even find the administration fee to be exorbitant, because I really know it's going to take some time. So I do commend all of you that have worked on this, and thank staff for putting it in easy to read communication.
Well, Tom, I appreciate your questions because, we've been working really hard to make sure that everybody is accountable, because we know we are. And working on this committee just brings it home to the fact of how accountable we are and how we have to ask our partners to be the same when we do this. So thanks, Tom.
Mr. Mayor, it's Commissioner Bynum. Just two quick things. With regard to Commissioner Burrows' question, I see James Bain, who's our legal counsel that's been walking us through this whole process. He's listed as an attendee, not a panelist. So I don't know if he can speak from the legal aspect to that issue of the accountability for the dollars, but I'm also not sure, but I have this vague recollection that MOUs that are created between the unified government and other entities do include disclosures of things like elected officials that serve on those boards of directors. So I think certainly we'd use one of the templates that we already have in place, but I don't know if Mr. Bain is able to respond to that particular issue or not. And then
I think I am, Commissioner. Oh,
hey,
I'm sorry.
Thank you. Go right ahead.
Hey, thank you. So to Commissioner Burrows' first question about the responsibility, my understanding of how it would work, a year from now, 2 years from now, if there's an audit, we collect the documentation from the 501c3s. We would collect documentation from Edwardsville and Bonner. So they would come to us for that audit. Of course, in the MOU, the organization has to cooperate with us in the audit. And so if there is an inappropriate spending, the state would come back to the unified government for reimbursement. Of course, we would put it in our MOU. An MOU is not binding, that the other organization would have to reimburse us. And we've talked about this, Commissioner, a lot of times in grants, and you all know this, you may only get a monthly piece of your grant. Your grant may be broken up into 2 or 3 parts. And in order to get the second part of the grant, you have to provide documentation of the first part, and so we've talked about that, or other safeguards. I know Crystal has other ideas on how to distribute the money and holding folks accountable for how they're spending the money without giving the entire chunk.
Okay, thank you. Seeing no more questions, Commissioner Bynum, is there any final remarks?
So I hope that it's clear as mud what we're asking for in our 7 o'clock meeting, but the resolution that's going to be in front of you at 7 is for basically this allocation formula moving forward. And then given approval for that, finishing out our work on the timeline that's been laid out. So other than that, I would just encourage any of you, if you've got a remaining question that's gone unanswered or a concern that you're not satisfied with yet, please email Commissioner Markley and Crystal Sprague, because we certainly want the questions to be answered. And other than that, thank you so much for hearing us out.
Thank you. Very good presentation. Thank you for all your hard work. We are adjourned and we will come back at 7. Thank you.